and gentlemen,
unexpected success.
oh!
Who are those guys?
It's the comeback team. Oh!
You already know.
Ladies and gentlemen, oh!
Oh, man.
Ladies and
It's the
gentlemen,
comeback kid.
ladies and gentlemen, oh!
Hey guys, welcome back to another episode of Unexpected Success. The Comeback Kids with Joy and
D. Robeson in the house. What's up?
we're coming at you this today with a special edition discussing the COVID vaccine with the illustrious Dr. Clenton Coleman and Dr. Suraj Saggar. Thanks for joining us, guys. Thanks for coming on.
I'm glad I'm illustrious.
I would have picked a different word, Coleman, but thank you for having us. Appreciate it. Illustrious would be a bit too generous for a man over there.
Oh, okay. Well, listen.
I can think of other words. I can think of some other words.
The last time I saw you guys, we were, literally it's 11 months ago. It's the last time I saw you guys in person, and we were seeing you, Dr. Saggar, and you were, literally kind of shell shocked because you had just left a meeting at the hospital on coronavirus, and I'm like, wow, is it that serious? Because at that time we were kind of still giggling about it, right? And you were like, no, this is you looked like shocked.
Yeah, I will tell you, we had no idea, obviously, what we were in for. And, myself, as in others, underestimated, quite frankly, the impact that COVID-19 was going to have worldwide. You had me on media back in January, February saying, well, you know what, influenza will be a bigger deal. Even the top brass, Anthony Fauci, was saying it's not really something we need to worry about, just be prepared. And the last time we saw each other, in your studio, things were reflecting and coming back to us, say, hey, this is going to be a problem. And I started telling people, you know what, we need to start preparing for extended stay at home. And I told people 2 weeks, just have groceries for 2 weeks. This will pass over. We'll go back about our business.
Right.
And here we are 11 months later in a changed world. So it's been a very humbling experience for sure.
Yeah. What about you, Dr. Coleman?
I just remember it being very surreal. It's like we were watching a movie, and people were saying like the zombies were coming, the boogeyman was coming, and we were like, yeah, whatever.
Yeah.
And then it's like now it's like a ghost town. So it's and it seems so much longer ago than actually what it was, even though it's only been 11 months. But I think we've all been through the ringer. And I think our job now is, now that the vaccine is out, is to try to roll that out to everybody, but especially communities who need it most.
Right. And I'm so inspired by that, obviously, because we know you guys could probably run through figures, right, of like how, communities, like the most impacted communities, right? And And ironically, those communities are not the ones that are going after the vaccine. So, we can totally hop into that if you guys,
Yeah, that's a huge, discussion, and Clinton and I are both so passionate about it. And so, just to put this in perspective, you have the African American community, the Latinx community, disproportionately affected by this pandemic, and it really brought out inequalities in our healthcare system to the forefront. And so that's first and foremost. We noticed very early on, and I always tell people this disease knows no caste, color, creed, religion, etc. It affects everyone. But it's very clear that certain communities have been disproportionately affected. And that's both socioeconomic as well as ethnic, from an ethnic point of view. And so as Coleman will attest, it's really brought these inequalities. And so not only do we need to address them, but we also need to look at the root causes of why are there certain populations in the United States that are so unhealthy compared to others? Why are there certain populations that have diminished access to healthcare? And I'll leave you with this one stat, and then we can talk about this in great detail. And can add, with the pandemic in general, the average life expectancy in the United States has dropped about 1 year. But if you divide them amongst different races, African Americans, it's almost 2.2 years. Hispanics, 2.4 years. White Americans, 0.4 months. So you add that all together, it's about 1 year. But that's very telling in terms of how people have been untowardly affected. And I think we should discuss that, but I want to make a disclaimer that, listen, every ethnicity, every culture, every religion has had untold tragedy. So it's affected everyone. But I think as a community, as a group of Americans, we all need to come together and acknowledge that certain communities have been disproportionately affected.
Right, right.
And I think Dr. Saggar will correct me if I'm wrong, but
I always correct you.
Yeah, of course. Even if I'm not wrong, he corrects me.
Right.
But
for instance, what are you golfing? What are you wearing over there?
This is my golf shirt. Yeah,
I noticed.
It's golf weather. But communities of color, I guess, are 3 times likely to be hospitalized and 2 times more likely to die from COVID.
Unbelievable.
And that's a big deal. And there are a lot of reasons why there are health disparities.
Yeah.
We've historically focused on the innate health of a population, which is not true. So, Black folks aren't, for most part, not innately unhealthy just because they're Black, but there's these things called social determinants of health. So that, affects your health. So just briefly, like where you live, your environment, your neighborhood, do you have access to good food, to transportation, to quality healthcare? Are you educated? Do you have good doctors who speak the same language as you, or culturally sensitive? And in regards to COVID, those things have been magnified. So, what you do for a living, like most people of color are blue collar workers, they're essential workers, so they have to go to work. They don't have the luxury of working from home, or the luxury of being able to miss work, and families to feed. So a lot of those things, have affected health disparities overall. So, the risk of diabetes, high blood pressure, obesity, heart disease, those social constructs affect those things as well. And then you throw on COVID on top of it. So COVID just so happens if you have diabetes, obesity, high blood pressure, kidney disease, you're at risk for worsening disease. And then you throw in a system that's not equitable on top of that. So you don't have good doctors where there need to be. Patients can't get good insurance. They don't have good access to health. And then they don't trust the system that's done them a disservice for, years and years. So that whole, mix is just a terrible combination of everything. So, our job is to try to unravel it as much as possible without, some of those things have been in process for, hundreds of years. Part of the civil rights movement was adequate healthcare for everyone. So, we're still in the process of trying to figure all that out. But, what we are working on, I guess in the grassroots movement is try to educate people about how to learn about their health, make educated decisions, do the right thing, and, seek adequate healthcare. So, it's a struggle. I think COVID has brought a light to a lot of these issues. When COVID's over, there's still going to be health disparity. So, this is probably the canary in the mine for us to work together to try to improve some of these discrepancies.
Yeah, well said, Clayton. And I would just add that, I think it's just fast forwarded what we already knew about these different discrepancies. And I also shedding light on these myths that, African Americans and Latins, they're just, like you said, innately unhealthy. Oh, they just, don't eat well. It's a typical diet. They're not health. We have to remove ourselves from these myths and say that's absolutely false. Everyone, wants a better life. Everyone wants a healthy life. But are there barriers in place? And I think it's very obvious, like Clinton alluded to, and we can dive into them, that these barriers truly do exist. And I'll take a perfect example, like Clinton mentioned, essential workers working in jobs that are unable to be done at home. It's very. I looked at my neighborhood. I think we're all blessed to live in areas with good schools, etc. But I look at a lot of my neighbors, and they can all work from home, and they have large houses. If someone, God forbid, got sick, they can quarantine. And they have multiple cars, so they car sharing and taking public transportation. That's not the case for a lot of groups of populations, right? They have to go to work. They have to take a bus. They got to take a subway. They got to take 6 people in a car. If someone gets sick, they got 1 bathroom and 1 bedroom among 4 or 5 people. There's nowhere to. There's no basement. There's no basement. Lounge and separate bathroom. During the spring, I slept in a different bedroom, different bathroom. I stayed away from my family because we were all so scared about bringing it home to our families. But I also look at it. I'm blessed that I was able to have that space in my house that I can do that. That's not really applicable for everyone. So there's a lot of things that even as a physician that I realize I'm giving advice, but that may not always be able to be followed. And that's not because the patient doesn't want to follow that advice. It's just not possible. So it actually, I'm sure Clinton as well, and all of us made us kind of open our eyes and realize that, hey, we need to dive in deeper to these social issues to understand, why this disproportionate effect among African American communities, Latinx communities, lower socioeconomic communities exists. And so it's a huge topic. And again, I'm just very, passionate about it, and I'm so excited, that we can all dive in together.
And then, can I touch on that?
Of course.
Even the and it's sad. Even the rollout of the vaccine has social and cultural bias, right? So the way they structured it is, you go onto a website, or at least in New Jersey, you go onto a website, and you wait in line, virtual line for a vaccine. How many people that I know that that are able to spend time on the computer? So the demand is so much so that everyone can't get online. How many 70-year-old Black folks have computers?
And exactly.
How many people in poor communities have computers or have the time to be on a computer and register? Right. We need to be out in the communities giving out the vaccine. So, and it's sad that people who need it most won't be able to get it. Just to give you some stats, in Bergen County, only 2% of African Americans, and I think about 4 to 5% of Latin and Asians have been vaccinated, compared to 51% of white.
51%,
So the most vaccinated population in Bergen County has been white women.
Wow. Yeah, it requires time. It requires internet. It requires a stable Wi-Fi access. Persistence.
Yeah, but those are determinants of health. Access to health. Access to getting a vaccine.
Yeah, but it's very difficult, like you said, when people are working 2-3 jobs. A lot of people are on standby, so that convenience is fine if someone's staying at home. It's not available when someone's working a bunch of jobs, worrying about childcare, and saying I can drop everything and get vaccinated at 4:45 in the evening because there's some leftover doses. So all these things added together, are very telling. And I think a lot of people just are blind to that. People will say, "Well, I wonder why the African American community, it's not that they don't want it; they can't, or we're not giving it to them, right?"
And that pisses me off, for lack of a better term, because it's so dismissive of everything else going on. So now the rhetoric is Black folks don't want the vaccine because they don't trust it because of the Tuskegee experiment. It's way deeper than that.
Right.
If you're putting the blame on the people who want it and need it, I'm lost for words sometimes on how we take such a complex thing and make it so simple, and we dismiss the people who need it most, and then the structural issues or racism that's led us to where we are now. So
I can say for sure that my parents would not have been able to get the vaccine had I not gotten super involved and signed them up, and it just wouldn't have happened. And what about you? And what about you, Dee? How did you get your parents? Did you do it yourself, or did they?
Same thing. I had to get involved. My parents are older. They have access to a computer, but they aren't that computer savvy. So I had to find a site. I had to set them up for getting their vaccination at Yankee Stadium. They live in the Bronx. They were able to go with my sister and her husband, but there are some older people who don't have access to computers, don't know how to use them. Those have family members who can help them out. And I think, like Dr. Coleman said, it's this whole stigma around this vaccine being bad for Black people, and it's a huge mistrust.
Yeah. So
with that said, let's kind of break down some of the myths of this vaccine, as well as kind of shed some light and maybe ease some of the fears that some people may have. So I was going to say the biggest thing that I've been hearing is in the echo chambers all over social media is the speed in which this vaccine was developed.
Yeah.
And so can you tell us officially, how long does a typical vaccine take to produce? And what was the time difference between this vaccine and other vaccines years ago?
Yeah, so I can answer that question. So one thing to understand is that there was no corners cut. There was some bureaucracy that was cut out. But in terms of studying the efficacy, that is how effective the vaccine is, the safety, and the studies in different patient populations, so between 18 and 65, those were just like any other vaccine. So you might say, Doc, well, then why does it take so long to get a vaccine for this disease? And why haven't we got a vaccine for HIV? I mean, it's because it's different viruses. So we are building upon what we learned about other viruses, which is why we're much quicker to get a vaccine now than we were in the past. Remember, just a little quick review, this is a coronavirus of which there's 7. So 4 show up every year. And then we had something called SARS in 2003. We had something called MERS in 2015. And of course, in December 30th, 2019, we were described by the Chinese, the WHO, COVID-19. So we're building upon our knowledge. That's one. And then 2, these messenger RNA vaccines, which are really an incredible feat of technology, that's been being developed for the last 30 years. So I think we've all heard about the Turkish scientists, husband and wife living in Germany, were really some of the big proponents, and a lot of their research is what led us to this stage. But this messenger RNA vaccine technology has been worked on since the early 2000s. So this is just a culmination, if you will, of all that hard work. So when people say, oh, we were cut corners, it was sped up. No, it's just reflective of the science that has existed for a very long time. We cut out some of the bureaucracy, some of the red tape, from going from a phase 1 to a phase 2 to a phase 3. And then there's certain criteria the FDA uses, but none of that was cut, right? So a perfect example, we all know, I won't get into details of how this was politicized. So we know that the vaccine approvals were not based upon a election cycle or what someone may or may have said we're going to have it next week. It all parts played out. And when there was certain side effects, things were paused, and then data was analyzed, and then things moved on. So everything was done just like anything else. It's just that we had the technology and the knowledge for the last 15, 20 years about coronaviruses in general. And so we already knew. Also, perfect example, we were able to sequence. That means we know exactly what the virus looks like by the middle of January of 2020. So only in less than a month after described, we had the whole genetic sequence. Well, guess what? Why is that important? Once you have genetic sequence, you know what to go after. So you get the idea. We are much more adroit, much more skillful at making vaccines. And also, thankfully, COVID-19 is a virus that lends itself to having a vaccine, unlike HIV, which mutates so quickly that, a vaccine still eludes us 30 plus odd years later.
So, was the genetic sequence similar to past coronavirus, SARS and MERS?
Yeah, so they're all a family. It's like family coronavirus. It's like me and Clinton have a similar family, way back when, but they have distinct differences. I'm better looking.
I'm not related to you.
So you see how different viruses, they differentiate themselves as they go along. So you have 7 coronaviruses. 4 that show up every year, by the way. Every year we have coronaviruses show up. It causes runny nose, watery eyes, the colds. It's the second most common cause after rhinovirus. But these 3 distinct coronaviruses are unique from each other. So they have certain characteristics that make it a family of coronavirus. When you look under a microscope, it looks like a crown. That's why they call it corona. Or it looks like a crown around the sun, actually, is where it comes from in Latin. So that's where that corona comes from. But they have unique characteristics. And this virus called SARS-CoV-2, very similar to SARS, but it has a unique protein, and that protein is what is the target of these vaccines. We know that protein, that spike protein, is what the virus uses to gain entry into the body, and that's what we're basically manipulating and taking advantage of when we use these vaccines.
I guess the analogy would be, preparing for Thanksgiving dinner, right? You chop up your onions, you marinate your food, all that stuff a day.
We had a tofurkey this year. I'm just letting you know. It was not good.
Saying the preparation has already been done, right? So the vaccine technology has been around, right? We know about the virus for a long time. Now it's Thanksgiving Day and you just whip everything together. And it seems like it's fast, but that preparation has been going on for a while. So I can understand how people can be wary, especially the system that exists for drug development, that it takes years to develop a drug, to research it, to get it approved. Yeah. And we're doing that in the span of, a few months to a year. But also just remember, it's emergency authorization use, right? So this is not a normal scenario. So, we've weighed the risks and benefits of, having a vaccine versus the risks and benefits of just trying to live it out with the virus. And we see we're probably 450,000 or probably more than that almost 500,000 people have died, unfortunately, from the virus.
Right.
So, there's nothing without risk, but the vaccine is the best thing we have to fight the virus going forward.
What would you say to those people who don't believe that close to 500,000 people have died from the virus? Because that's also a huge, right? Myth circulating that, no, that's just a pumped up number by the liberals or whatever. And again, I don't want to politicize this, like even talk about that. But at the same time, I've heard so many people say, online, essentially friends, even people that I went to law school with, right? The educated people who are saying that there's no way that many people died.
So I'll tell you, Joy, I mean, this is a pandemic, ND, but this is also the first pandemic in the social media era. So, we clearly have an infodemic, right? We have now everyone, and I joke around, tell people, well, don't listen to infectious disease experts who are Facebook certified, but now everyone's got a voice.
Right.
You have literally a pandemic of information going on. Again, hence the infodemic. And I initially thought, well, this is uneducated people. This is people who are, poorly educated, who are misinformed. But then you realize, as you mentioned, no, there's people who came out of the woodworks, who are educated, who come from every background of life, friends, not so much family, but friends, acquaintances, coworkers, even from who can be highly educated, and they also have fallen victims to some of these misinformation that it's out there. So it becomes very telling. So there's a couple of issues we can discuss. One is you have to vet your sources, and unfortunately, there's just too easy to make a slick social media ad, put some stats that may or may not make any sense, put it out, and people say, "Yes, you're right. I knew you were right." But then I realized what is, and actually early on, I realized when people were doubting and texting me and saying, man, is this a really big deal? And, Clinton and I are in the hospital, things are going crazy. We're reporting to the media, it's like a war zone. And people are at home saying, man, I'm sick of sitting home watching Netflix. This is all a big deal to get rid of one president and get in another. It's a political issue, right? And then I realized, how are these educated people believing this? And actually, there've been studies that are showing during times of great stress, and we can look at our history and understand that. That people just are much more easy to fall victim to these degrees of misinformation. We can look at our history through, terrible times that happened even in the 20th century. So there is clearly something about a pandemic, about people staying at home, a lot of time on their hands, perhaps, consuming a lot of social media of questionable content, questionable background that lends themselves to people just kind of falling victim. And again, and I apologize, I got Otis over here with me, so he's sitting in my lap. But
Otis.
Oh, good, Otis.
It has become very real, very disturbing. And early on, I was incredibly disturbed, and I tried to do my best, and we all did as physicians, to educate the public. But I think there's a major disconnect. And I think that's why it's important from all social media aspects, whether it's the news, podcasts, whatever, for people out there to really understand what really went down, continues to go down, and the human cost associated with this.
Right. Speaking of cost, another thing that I've heard why this is not real and the numbers are inflated is because hospitals get paid more to write the death was from COVID. And is there any truth to that? Or how do you manage that argument? What is the fact behind that crazy notion?
You can answer that. I don't. Yeah.
I'll let Clint just follow, but let me just tell you two things. We had two nurses who brought it home, and this has been well publicized, so I know if they're listening, they would not mind because they have mentioned it before, who brought it home to their husbands and both died. So to people who say this is made up and this is the way for doctors to make money, I've heard that the same way, hospitals to make money, nurses to just get pity for themselves. Look at all the people who put themselves in harm's way, who brought it home inadvertently. Clinton, we know who I'm talking about, Clinton. Wonderful nurses who, just by doing their job early on, brought it home, both under 50 in their 40s, dead. So that idea of just making up causes of death is egregious and just despicable. Hospitals are not paid more money if someone dies of COVID. This is a way to understand the burden of the disease. And I can tell you many hospitals were overwhelmed by COVID. They're suffering because a lot of the other more, let's be frank, revenue generating procedures and things like that were canceled. So a lot of hospitals, doctors groups, organizations were under a lot of incredible strain because of COVID. So it is completely false and egregious and insulting in numerous ways to suggest that, well, anyone that died would be just labeled as COVID. And I will tell you that we're understanding more and more of the disease. It's not always apparent. And we know a lot of people in the early on, especially, did not seek healthcare. So my ER friends would tell me they were called way more than often in the spring to declare people dead, that the cops found, neighbor found something was smelling in someone's apartment, someone was found dead. And yes, probably a large percent of those patients can be attributed to COVID, whether directly, indirectly. People may have had COVID, scared to come in, and then end up dying of a heart attack, a stroke, etc. So you have to understand, it's not always clear. It's clear in the hospital if someone dies of COVID. But early on, remember, it took a week or 10 days to even get a diagnosis of COVID. We weren't very good with our testing like we are now. Right. So people have to put these things in perspective. And again, if anyone has any doubts, I invite them to really just understand the truth and see what healthcare workers, not just doctors, not just nurses, policemen, firemen, first-line responders, those who work in restaurants, those who clean the rooms in the hospital, environmental science people, housekeeping, etc. They're all put themselves in harm's way. We had numerous employees at our own hospital who died, including patient transport. My first patient who died was a 45-year-old cafeteria worker who was just trying to do his job serving doctors, and nurses and staff during the pandemic. He acquired it. I didn't really think he had COVID. I thought he had indigestion. It was incredibly humbling, and this has been discussed before in media, and died several days later, and that'll haunt me for the rest of my life. So this has affected a vast majority, wide swath of those that work in hospitals and medical care settings. So again, that idea that has been purported, I've heard it before, is incredibly hurtful, and
I agree. I agree.
Well, we didn't say it, but we want to thank you guys both
Yes.
for putting yourself on the line. Like that's probably what should have been the first thing we said to you guys. Like, we are forever indebted to you guys for putting yourselves in harm's way to keep us all safe. So thank you for your service.
Absolutely.
Yeah, and I'm sure I speak for most of the medical community. We'd rather be doing something else than spending all our time in the hospital, risking our lives, our families' lives, our friends' lives, trying to help people save lives. This disease is a tough disease. I mean, it's humbled us all. So there's a lot of mental stress that we've all gone through, physical stress that we've gone through and still go through. So you got to remember, these are people. These are someone's mom, dad, brother, sister. People, whole families have been decimated by this. So I know we look at the numbers and we see a lot of numbers, but these numbers have names, and everyone has a story. So I don't think any one of us or even any organization is incentivized by COVID-19 and the damage that it's wreaked on our lives and the economy and the society. So.
No, I mean, of course, we're empathetic to everyone that it affects, including people who are not in healthcare. So we know it's mental health issues with students and people staying at home. And, I'll be honest, I was guilty of this. I used to say in the beginning to my wife, man, it's nice. I have a lot of neighbors who work in finance or white collar jobs that are home. And they, and I'd be like, man, I would like to be able to work from home and just, catch up on my Netflix, what have you. But, that's a very silly thing for me to say because I realize this is affecting people who are maybe not directly involved with healthcare. But, I understand the mental and emotional anguish that goes along with quarantine, et cetera. And, Clinton and I in the beginning, especially in the beginning, we're so busy just working. We really didn't have time to reflect. I would just work, come home, sleep, rinse, wash, repeat. But then you realize it's not easy for people to stay home in quarantines from their loved ones, et cetera. I just didn't have the time to think about it in the beginning. So we always acknowledge the effects on everyone, not just healthcare workers. So as you said, thank you to us. I always tell anyone who will listen, I thank you, for staying home, doing the right thing in the beginning, crushing that curve, that first surge, which could have been even much more deadly. Of course, we've had a second, third surge, and now we're doing our best to prevent a fourth surge in next month as we see the new UK variant taking hold. But that would not be possible with the general population, in general, being adherent to mask wearing and staying at home and social distancing. So we thank all of you as well.
Well, thank you, because as Dennis is a new parent, and
congrats.
So and obviously, Dr. Coleman, you and I have kids similar age, around the same age, and so that poses its own set of challenges, either school age or newborns, infants. Sure. So yeah, no, it's been trying, but obviously it could be a lot worse. So we're just kind of counting blessings. So talk to us about what you guys are doing in terms of really trying to get the word out and trying to end some of the disparities that you've seen. And just kind of moving forward, trying to get us out of where we are now, right? And trying to, I guess, also, can you talk to us about kind of how this herd immunity thing works, and if more people get vaccinated, like what this means for the future?
So I'll answer the first question, and Dr. Saggar can answer the second question. So I think, our main job is to try to get the word out, to educate the public about, this disease, what to do to prevent it, how to treat it, and the importance of the vaccine. So it's our job to dispel all these myths, to provide a good education so people can make educated decisions, to make the decisions for themselves. So some people may think that they've weighed all the risks and benefits and they've come to the conclusion that certain treatment is not right for them. That's okay. But at least as long as you made an educated guess, I think that's the best thing. So I just wanted to highlight, we're doing a program next week. So it's a virtual town hall. Dr. Saggar and I will be talking about COVID-19, the vaccine, and then the impact on communities of color.
What date is that?
So that's February 24th at 6 p.m.
Okay. So
you can go to Holy Name Hospital's website under their event calendar, or you can go to mpn-nj.com. That's Medical Professional Network New Jersey.com and register for there. So it's a virtual town hall. Dr. Saggar is going to give a nitty gritty about COVID, the vaccine. We're going to talk about, what the good and the bad, and answer questions. So it's going to be no holds barred. It's like talking to your uncle at Thanksgiving. We circle back to Thanksgiving again, but
that's awesome. We'll make sure to promote that.
And the reason why that's important is because Dr. Saggar is going to talk about herd immunity, but herd immunity is going to come whether Black folks are on the train or not, right? So, herd immunity requires a certain amount of population to be immune to a certain illness. It doesn't have to be white, Black, Asian, Hispanic. It could be all white for all anybody cares. So that's why it's important for everybody to be involved and to be educated about the benefits of the vaccine.
Yeah, but I'll just tag on to that, because that herd immunity depends upon each virus and how transmissible it is. For COVID, we thought about 75% of the population. Now, with the more transmissible variant circulating, the UK variant, it might be up to 85%. But like Clinton says, it doesn't matter how we get there, so to speak. But if people don't take heed, getting there will be very painful, and you're going to continue to have a lot of illness and possible deaths and long-term effects. And that's one thing we didn't touch, before we get to that.
Long-term effects, right.
85%. And one thing we didn't touch about is we talk about inflating numbers, and people say, well, why are you guys so hyped about this? A 1%, 1.6% death rate. Well, look at the long stream and downstream and long-term effects of COVID. We are still just now understanding, Clinton sees plenty of patients with renal failure in the acute setting, but also long-term. We don't know what the long-term effects. We call these long hauler syndromes. About 3 in 10 people, 30%, maybe up to 40% of people with COVID will have what we call COVID brain, or COVID fog, where you just are not cognitively yourself. You're a little bit slow. We have the concern for developing seizures in children, learning disabilities. We see people with gastrointestinal illnesses, loss of taste and smell. And we're still learning every week. There's things getting added on. Autoimmune disorders. So think about things like lupus, rheumatoid arthritis, inflammatory bowel disease like Crohn's disease or ulcerative colitis. This COVID is a very nasty virus, and the whole idea is that it's not the virus itself. But yes, if it killed everything in sight like Ebola, it would never get to a pandemic, right? Because people get so sick, they die. It doesn't really have a chance to spread on airplanes around the world. The idea with a virus, it has found a niche where and all viruses are trying to do. Remember, I always tell people they were here before we were here, depending on what you believe, and we'll be here probably long after we're gone. Is they were just trying to find a host and replicate, get people sick enough, but not too sick, so sick enough that they cough, sneeze, and spread to the next person. And from an evolutionary point of view, that's all it's trying to do. And this virus has now really, it's like a perfect storm where it gets people just sick enough, but doesn't kill everything it sees, to spread it from person to person to person. And now it also is so widely that it's now looking at, but it's now looking like it can cause all these downstream infections and illnesses that we're still just understanding. So you can't just look at the death rate. You have to look at the long-term effects, the so-called long hauler syndrome. And that is, not something that, you should take lightly. And you can talk to plenty of people out there who survived maybe with a very mild disease, but still have long-term complications.
And in terms of, when you bring these things up, right, and all of these, kind of after effects or what happens, after you have recovered, right, from COVID, what about kids? I know that the vaccine is unavailable for kids under 16, right? So how does that work with children? If your child contracts COVID, will they too be, subject to having these potential
long-term effects?
Long-term effects?
So I'll start, and Clinton can continue. But this is entity multi-inflammatory syndrome in children, MIS-C, and we're seeing it now increasing in its incidence and its prevalence and getting more severe. So in the spring, about 50% of kids require an ICU stay. Now up to 70-80% of kids require an ICU stay. So I'll tell you, it's still rare. Most kids do survive. But what are the long-term effects of this? We don't know. What is the risk factors for this in children? Is it if they're obese? We just don't know. It seems to be somewhat random. And how is this being affected by the variant strain that's being spread out there, the UK variant? So there's a lot of things we still don't know, especially in children. And as you alluded to, the vaccine is not approved for children as yet. So don't take it lightly that, if my kid gets it, he'll probably be fine. It's not always a given. Right. And you need to find in the short setting what the long-term settings are in terms of intellectual development, cognitive ability. We know this virus affects the central nervous system, and in kids, it's still developing, right? So that's still a big risk that we have to take. So I hear from a lot of people that, what's the big deal? All the kids are going to do fine. They're gonna runny nose and water eyes. You got to take that with some
right.
With some salt. Sorry, I'm gonna hold him. Come on, man.
So with that said, is it too early for you guys to know if taking a vaccine will prevent any of these long-term effects if you do contract coronavirus?
In general, or in kids, or in
no?
general?
If you get the vaccine, right? Say if you get the vaccine, are you still susceptible to these other effects?
Well, the study is still ongoing as far as the benefits of the vaccine long term. We know it decreases your severity of illness, hospitalizations, death, but we still don't have enough data going forward to know does it prevent these downstream symptoms, which to me is scary. I would hate to lose my sense of taste and smell.
And I'm already in a fog. I don't need any more things foggy.
And then even though the rate in children is very low, that's pretty scary. We're all parents. We don't want any of our kids getting sick from any of this, right? Yeah. So I think I think to me that's the scariest part. The question is, what happens when the adults have herd immunity? Hopefully by that time we'll have some information about vaccinations in kids.
Studies are ongoing with children now under the age of 16 for one vaccine, under the age of 16 and 18 for the other. So it's very normal for vaccines to be approved initially in adults 18 to 65 and above, and then look at pregnant women and children. So there's still no great reason to suspect that the vaccine will not be approved in sometime in the near future, maybe as early as the fall, for children. But in the meantime, prevention is still the best bet. And one thing I'll mention about that multi-inflammatory syndrome I mentioned is that it occurs quite at random, right? So we've seen cases in children, while not common, it's still not rare, across the board, and oftentimes very healthy. I feel like a lot of people in general will say, well, so-and-so got this bad illness or bad effect of this virus, but they had disease X or Y on top of it. Somehow that makes people feel better. But when you tell people, no, there's a healthy child, football player, played high school sports, what have you, you have to realize that there are plenty of these cases where people who had no underlying chronic illnesses. So that's something to keep in mind, and that's something that we have to just keep in the back of our minds, and not just assume that our kid will get it and it's like a common cold and it'll go away.
Right.
Is there any truth to blood type that COVID might be thrive better, say with the blood type A versus blood type O?
Well, it's a theory at best. It has not been proven. It's something that's being looked at. Like Clinton mentioned, all the different effects, different risk factors for COVID-19, obesity, diabetes, lower socioeconomic status, certain ethnicities, etc. But when you account for all of that, there's still some genetic variability amongst populations. And we've all seen as healthcare providers and doctors, patients who did not have risk factors who still got very sick. So that tells us there's still other factors at play. Right. Blood type being looked at, but it by no means has been solidified as either putting you more at risk or being protective.
I see.
Yeah. As I tell people all the time, this is in evolution, so you guys stay tuned really because every week we're adding on things, we're changing things, and that unfortunately can lend itself to people saying, well, these docs don't know what they're talking about. But no, This is a pandemic unfolding in real time. And remember, we've only known about this virus for a little over a year, right? I mean, it's described, like I said, December 31st, 2019 to WHO by Chinese officials. Middle of January is when it was sequenced. End of February, it started showing some sporadic cases in the United States on the West Coast. And obviously all hell broke out in March. So we've come a long way. But again, this is just evolving in real time. And we're watching it all in real time unfold.
I think we've done a poor job about messaging, especially during a public health crisis. There's been a lot of, and that has a lot to do with politics, but there's been a lot of mixed messages, wear masks, don't wear masks, wear 2 masks, 6 feet, 12 feet, your freedoms and all that stuff. And I think that's probably why the numbers are so inflated and why we really haven't been able to take control over the messaging. So I think, when during an election season on TV, you see a ad for so and so and such all the time. We really haven't put that much effort into messaging, giving the good message to the population about COVID-19, wearing masks, social distancing, the vaccine. I think our story might have been a little different if we put a lot of, necessary work in the beginning as opposed to trying to fix everything now.
Yeah, agreed. I mean, it's been crazy for us. I can only imagine how it's been for you guys actually being, like you said, like in the war zone, right? Where you actually see these people coming in and, they had refrigerated trucks. I grew up in Rockaway Beach, Queens, and they had refrigerated trucks out there for the amount of bodies. And so it's just like, it's like you said, it's surreal, right? So I don't know. Do you have anything else for these illustrious physicians?
I do. Parts of questions, yeah. I mean,
I do because everyone's like, "Yo, ask them this, ask them that." Have you seen with this vaccine, right? Have you seen any side effects? What are the side effects? How long it will last? Because everyone's like, "Oh, well, I don't know what side it's going to be. My leg might fall off next week." All this excuse we make up in their mind to justify them not taking the vaccine.
Right. So I'll tell you my story because we both had the vaccine. One is not a microchip. You're not getting DNA implanted into you.
I don't want intelligence with the conspiracy theories. I said, I'm not going to offend the doctors with the nonsense. But
right.
But there are real concerns too, Clinton. I mean, those are valid.
Oh yeah, they're a real concern. So I think just the more people see that people they know have gotten it safely and there's really low risk, there are some complications. So most people with the either the Pfizer or the Moderna, after the second shot, they have some localized, either localized or generalized muscle aches and pains, low-grade fever, some fatigue or malaise that wears off within 6 to 12 hours. So I felt that. I still went to work, but as I explained to people, and Dr. Saggar explained it probably even better than me, your immune system it's working. It's building itself up to actually fight the virus when you do get exposed to the virus, so you don't get sick. So the fact that you had those symptoms means that your body is doing the right thing.
Correct.
Yeah, I mean, it's what we call reactogenicity. It's basically your body producing antibodies. So it's being pumped up by the vaccine and primed and then ready to go. And I'll tell people to look, about 3 to 4 out of 10 people will have moderate flu-like symptoms. And if you can, plan it on a Friday, your second shot, so that you have the weekend to recover, take a day off from work. You know, I work a lot of weekends, but I did my second shot on a Friday. Saturday, I won't lie, I spent the day in bed just watching TV, reading. I was feeling sick. You know, I played the man cold to my wife, so she said, all right, fine, I have to do the laundry, the dishes. And just so you know, I texted Clinton, I said, man, you know, I'm hurting a little bit. He said, don't be a baby. And lo and behold,
I didn't say baby.
He was laid out. He was laid out. And he missed his golf game, which he doesn't miss for anything. So you knew that he was having some symptoms. But again, if you feel empowered that, oh, okay, I have a little bit of flu-like symptoms, I can handle it, manage it with some Tylenol, etc., it's reflective of my immune system now pumping out antibodies. Well, then instead of taking it as a bad way, you say, well, no, this is actually a good thing. And guess what? It's a small, tiny price to pay for immunity, protecting yourself, protecting your family, and protecting the societies at whole.
It's like when Saggar works out every 6 months, when like he does his
I'm going to work
biceps.
out. I'm gonna go run outside, rock the style.
The day after he does it, he has a little bit of pain, but then the following day, he knows it did something. Like his muscles are slightly bigger. But no, I'd rather have some aches and pains as opposed to than being on a ventilator or losing a foot or having a stroke or even losing my taste. So I'll take that any day, especially if you can say that there's 95% chance that I won't get sick.
Now, for those people who have
things that you should expect some arm soreness. So a lot of people that didn't have other symptoms, almost majority will have arm soreness. So consider getting it in your non-dominant arm. So obviously you're right-handed, get in your left.
Right.
I think we've seen a lot of people, and just interesting, it's usually the younger people, 30s, 40s, 50s, who are getting symptoms because they have such a robust immune system. 60 and above in general are not having the severe symptoms. Again, it still makes the immune system work properly, but they may not have such a robust immune response. But the majority of those patients will still tell me, well, I felt fine, but my arm is pretty sore. It's very similar if you've ever gotten a tetanus booster. It's very similar to that. So definitely consider taking a day off after your second shot or doing it on a Friday or Thursday so you have the weekend to recover. And definitely recommend getting in your non-dominant arm.
And what about, I know that there are some instances where people who have like allergies or, there's been a few cases of people who've been adversely affected, right? And what percentage of those people, what's the likelihood of that happening? Even like the doctor in Florida that hemorrhaged or he had some kind of condition.
You always have to be careful because unfortunately bad things happen all the time. So as you get more and more people vaccinated, you got to say, is this caused by the vaccine? Or is this an association, which means the person would have gotten adverse outcome X anyway? So we know every day people develop different things. And that doctor that you talk about is something called ITP, idiopathic thrombocytopenia. We don't know this definitively related to the virus. So if you look at the incidence of what happens normally and what happens with the vaccine, there may be no difference. It may be just unfortunate. If you vaccinate enough people are going to have bad things. People unfortunately die every day. People develop diseases every day. And there may be just a coincidence someone got a vaccine preceding. Of course, every adverse effect gets reported to the FDA and they do their own internal review, as should be done. But people need to be careful in the media. It's very important, very important people understand media sensationalizes things, and it's hard to imagine. So you may say so-and-so had a stroke 2 days after getting the vaccine, but guess what? That patient's a diabetic, smoker, hypertensive, what have you, may have developed that stroke anyway. So there may be no difference in the incidence of strokes for that day and people who are vaccinated and not vaccinated. So you have to look at the data. And it's really important not to just look at media headlines.
Right. And in terms of allergies, like I know my mother-in-law has pretty severe allergies. Is a vaccine okay for her?
No, so if you have a penicillin allergy, if you have an egg allergy, latex allergy, this is all fine. This is a brand new technology. Only if you've had severe effects or adverse effects with vaccines in the past, then you want to talk to your healthcare provider. But the most common things in the past have been eggs, latex, etc. People have asked me, I have a penicillin allergy, I have an iodine allergy, CAT scan allergy. None of those are are restrictive or prohibitive for getting the vaccine.
And why?
And the ingredients are relatively benign.
Minimal,
Yeah, it's not like you're getting something that it's you can explain better, but you're really just getting a message to tell your body to make something to protect yourself. You're not getting any part of the virus. You're not getting any live virus. You're not getting anything bad. So it's just literally getting a text message or a message saying, make this to protect yourself. So make the spike. It tells your body to make the spike protein. Your normal cells make the spike protein and protect yourself. So you're not getting any of the virus. So I want to make people aware of that.
That was my next question, because they was like, what's in the virus? They're going to, again, all
there is no virus.
Why their voices like that, Dennis, when you say
well, I got friends in high places, I got friends in low places. You know what I'm saying? Some of my low place friends are like,
yeah, what's up?
So, but I'm trying to inform them the importance of getting it.
No, Clinton talks like that off camera too, so I hear
sure do.
Right, so I'm like, oh, I don't know what's in the virus, son. They may have some. I don't know. I'm like, so
but you know what? I would say,
it's like, wait, can I say something?
It's important not to dismiss people, and I think that will go a long way.
Exactly.
Always trust. So anytime Pearson asks a question, no matter how foolish I might think it might be, I think it's important for all of us to acknowledge, hey, I understand your concern, but this is the situation, and I think people will get that.
And you should know what you put in your body, and it shouldn't stop at a vaccine. It should stop. You know, what medication did you prescribe me, doc? What are the side effects? Like it's funny, we have bias at certain things. We don't ask. What
was that McDonald's sandwich I just consumed? We don't ask
that, or even medications, that Tylenol. There's a risk of death. There's a risk of bleed. There's a risk of tons of things that we think is benign. Right. That Viagra you asked me for, or that weight loss pill. There's risk for that, but we don't really do our extra due diligence when those. So there's some bias when that's concerned. So. But no, the point is that you should do your due diligence and know what's in the vaccine and get it from a reputable source.
So there's no parts of the virus in the vaccine. It's just basically, like you said, something that tells your immune system that, hey, create this protein that's going to fight.
Like Clinton said, it's like a code that you're just giving us code to make a bit of the virus, but that little bit, it's like making a fingertip on my hand. So there's no me in there. You get a fingertip. And then your body identifies that fingertip and makes antibodies against it. But guess what? The virus uses that little protein, that little protrusion from the surface of the cell to gain entry. So that's all you need. You just need to stop that little piece of the virus, that little protein spike. So you don't need the virus itself.
But you're making it with your own supplies too. Your body's making the protein.
So that's the elegance of this vaccine. And by the way, this messenger RNA technology is not only for COVID-19 vaccines. It's going to be used for a whole host of things, including something called CRISPR. So if someone has, let's say, sickle cell disease, and you want to try to change the genetic tendency for sickle cell disease, which we know is seen in a lot of West Africans because it provided an evolutionary benefit for malaria. So there's a lot of applications for messenger RNA. So I would say people should really look at it as an incredible step to the future of medicine and the next logical step of medicine.
And then how do these vaccines differ from Johnson & Johnson? Is it the same technology for Johnson & Johnson? Do you know? Oh, I'm sorry.
So Johnson & Johnson is slightly different. So when you get from the messenger RNAs, which is Moderna and Pfizer, then you have other that use sometimes something called a adenovirus. It's basically using a benign virus to deliver a piece of the virus to just like the messenger RNA, so you can make antibodies. Or sometimes you just bring the whole protein. Instead of telling your body to make the protein, you just bring the protein in. And that's what the Johnson & Johnson, that's a protein. So, there's pros and cons of each. Of course, that being that it's only a one-time.
So one dose, right?
Yeah, and then it doesn't have the stringent cold requirements. So it's good to have lots of different manufacturers out there, because what's good for the United States may not be good for the developing world, right? Because they may not have access to the cold storage technologies. So after the United States, actually India now is developing, probably going to be the second largest developer of vaccines in the world. And a lot of the vaccines they're developing are the non-messenger RNAs. And that's incredibly important for, let's say, sub-Saharan Africa, Southeast Asia, Central and South America, because a lot of these places and rural areas, because it's ludicrous to think that they can have transport minus 70 to minus 90 degrees.
These deep freezers.
Communities and mountains and rural areas. So and it's ludicrous to think that you're going to have someone remember to come back 3 or 4 weeks later when these people are hiking, 20, 30 miles to see a doctor. So we need a lot of different variety types of vaccines, and we need a lot of producers out there. So if there's a supply chain issue with one, we have supplies with the other, because we all know right now with the snowstorm and with the supply, it's still a big problem rolling out the vaccine in the United States, right? Which is supposed to be the wealthiest country in the world and have the best healthcare system. So, there's still a lot that needs to be done in terms of the infrastructure to get this vaccine.
And just think of like we're having problems getting the vaccine, and we're in a developed country, right? Like imagine what Black and brown people and indigenous people and poor people all over the world, like they can't go to the Rota Center or CVS to get their vaccine twice, right? Like
right.
So it's there's a lot of work to be done.
So one last thing before we let you guys get out of here. What would you guys say, both doctors, to the people in Black and brown communities as to why they should let all these fears and these conspiracies about the vaccine and go and get themselves protected?
So why?
I would say, make sure you're getting the right information from the right person, right? Like, I'm going to go do my taxes. I'm not going to do it with the plumber. I'm not going to do it with the auto mechanic. I'm going to do it with the accountant because he's trained to do it correctly, right? So you shouldn't get your information from the gram and Twitter and Facebook. You need to get it from a reputable source.
YouTube,
and that,
and
that reputable person will give you, hopefully, the nitty gritty of why the vaccine is good for you, what's in it, what's the risks, what's the benefits, so that you as a patient, as a consumer, can make an educated decision whether you want to take the vaccine or not. So once you get all the information, it's more than likely you will make a good decision that will benefit you and your family. So I think just the messenger is really important in this equation, as opposed to the message. The message is important too, but getting the right information from the right person, I think, is something that we're challenged with and something that we're working hard on going forward.
Yeah, and I would just say, finalize by saying that, good health is not a privy of just one population. I think all communities want good health. They want the best for their families. They want the best for their communities at large. And so, medicine is one of those things, it's a humanistic occupation. You want to help everyone. And so people should look at it that way, that, this is not a white disease, Black disease, brown disease. This is a human disease. We're all interconnected. We're all family. We're all human beings. We're all members of this earth. And we all need to do the best that we can and understand that one of those things is health, and health is good for everyone. It's not a politicized thing. It's not a color thing. It's a human thing. So, do it for yourself. Do it for your communities. Do it for humanity.
You just listened to The Comeback Kids, presented by Unexpected Success with Joy and Dennis. Please like and subscribe.